Open enrollment is up and running. This is the annual enrollment window on HealthCare.gov, the private health insurance marketplace established by the Affordable Care Act. Now, open enrollment started November 1st and runs through January 15th of 2022. During this open enrollment time, the Centers for Medicare and Medicaid Services will be providing some enrollment snapshots of how many people are finding their way to HealthCare.gov and making their plan selections for 2022. Now, they measure enrollment in the weeks that start Sundays through Saturdays. So the very first data release is from November 1st through November 6th, and things are off to a good start. CMS reports that there were 774,000 plan selections, and that's just from the 33 states that use the federally facilitated marketplace. It does not include data from those states that run their own marketplaces. CMS breaks down that number a little bit further and says that about 17% of those were new consumers. The remaining 83% were people that were renewing the health coverage they had in 2021. There were about 1.3 million consumers covered on those applications. And then they gave us a little bit data of just the traffic to the website. About 2.7 million people found their way to healthcare.gov. 210,000 of them were window shopping, and there still is that option available. You can preview plans and prices before you fill out an application so you can get an idea of the plans in your area and the prices. Now, it's getting a little tricky to start doing those year-to-year comparisons of how open enrollment looks this year compared to last year. And there are a couple of reasons for that. First of all, there are fewer days reported on this first snapshot. It only took us November 1st through November 6th. There are fewer states participating in the federally facilitated marketplace. More states are running their own exchange, and their data is not included in these initial snapshots. They will be captured later as open enrollment comes to a close. And that's actually a good trend. When states can start operating their own marketplaces, they have more flexibility in what they provide. Now, we know that this was a smoother start compared to previous years. You might remember some of the computer or technical glitches in years past. We aren't hearing reports of that in this open enrollment period. We also know that comparing data is going to be hard because open enrollment, like we said, runs longer this year. It runs through January 15th of 2022, a couple extra days to give people more time to find their way to healthcare.gov. And that's how you apply. HealthCare.gov. We also give the phone number in the description below if you'd like to apply over the phone. And help is available. You can either select Find Local Help off of the HealthCare.gov website. If you are in the state of Wisconsin where we are, you can visit wiscovered.com. If you want to read more of the data from that first week CMS data snapshot, we link to that in the description below.